Today, we're excited to introduce a new service that will expand access and enhance patient care: on-demand virtual visits. Over the next few minutes, we'll cover what an on-demand virtual visit is, how it works, and what types of patient visits on-demand is appropriate for. During an on-demand visit, clinicians provide the same level of care as a scheduled virtual visit or in-office appointment, just without the need to schedule. Patients can access this service immediately from their phone or computer when and where they need it. Just like a regularly scheduled visit, on-demand providers will be able to discuss symptoms, diagnose conditions, prescribe treatment, including ordering labs, imaging or procedures, or prescription medication. On-demand visits can also handle routine follow-ups and medication management. Our goal is to provide a convenient and accessible option for patients with more urgent or immediate needs. On-demand visits will be extremely beneficial for patients on the phone with the call center or triage and are in need of care, for urgent referrals, or patients experiencing uncomfortable symptoms. Suggesting an on-demand virtual visit may also be a good option for patients dealing with more time-sensitive issues who cannot wait for a scheduled appointment. On-demand is not appropriate for medical emergencies. In order to use the on-demand virtual visit service, individuals must be established patients who have been seen by a Washington gastroenterology provider within the last 3 years and are age 18 or older. Patients will also need to enter valid insurance information for a plan that does not require a referral. It is important to note that there are some groups of patients that will not be able to use on-demand virtual visits at this time and will be directed to contact the office instead. Patients not using insurance to pay for their visit, patients with an insurance plan that requires a referral, patients under the age of 18, new patients, patients who have not been seen by the practice in the last 3 years, patients who have been terminated, and patients who are in collections. If any of these patients attempt to start an on-demand virtual visit, they will be directed by the system or by the provider directly that they are not eligible for on-demand visits at this time and will need to contact the office. The most important thing for you to know is that it is easy for patients to access on-demand visits, and you should feel comfortable recommending this service to our patients as an option when they need care. If you have a patient that would benefit from an on-demand visit first, send them to our website at washgi.com. From there, they can click on the Services tab and then the Virtual Care link to find the on-demand televisit link. They will immediately enter the registration page for on-demand visits. Registration is quick and easy and can be done on a mobile phone or computer. After filling out the registration form, providing their insurance information, and telling us about their reason for visiting, they will be placed in line and their on-demand visit will begin shortly. There may be a short wait if the provider is seeing another patient, but they will get a text and an email when the provider is ready to start. It's just that easy. On-demand virtual visits are just one more way that we are providing our patients with the best possible care, convenient and accessible, on their terms, when and where they need it. On-demand visits will be available starting Wednesday, January 24th at 8 a.m. Pacific Time. On-demand virtual visits will be available weekdays, Monday through Friday, from 8 a.m. to 4 p.m. on the WashGI website, just a click away. Thank you for your support in our launch of this exciting new service.